This video, we are going to be doing the neck and upper extremities test, check off, sorry, not test. Alright, so always wash your hands, knock, provide privacy, introduce yourself to your patient, and ask him their name and date of birth. So we'll get right into it. Always, when you start with this one, you start with the carotid artery. You always feel bilaterally, so each side. And you feel, since it's a pulse, you're feeling for rate, rhythm, and force, and make sure that's equal bilaterally. And then after that, you use your stethoscope, you use the bell or the small side, and you're listening for what's called bruit. So, and you just put it on. I'd put it in my ears, but I'm not going to listen right now. And you listen to both sides, and if you hear it, you're supposed to palpate for thrill, but he doesn't have any, so we're good. And then this next one, he's pretty young, so he won't have jugular distension, but we have to do this anyway. So I would put him in a hospital bed and lean the bed up 45 degrees and have them turn their head away from me so I could look at their neck and see his jugular vein popped out, but he doesn't have it, but always looking bilaterally. And then after that, I would go from the jugular vein into the trachea. I'm always making sure it's midline. And then what's on the trachea is the thyroid gland, and it's right here. The way you find the thyroid gland is you start at the chin and you go down the patient's neck until you feel the first little notch here, and that's the thyroid gland. And you can press on one side to feel the other side, and then do the other way. And then I would give him a drink of water. Oh. And then as he drinks it, I would feel his thyroid gland moving up and down, which it did. But I'm always looking for if it's swollen, if it hurts, if it doesn't move up and down. And then after that, we are going into the lymph nodes. And when you look for lymph nodes, you always go in a circular motion using the pads of your fingers. And when you're looking at lymph nodes, you're always making sure they're soft, smooth, non-tender, that they're movable. Usually you can't feel them unless they're swollen, so if you can feel them, it's probably not a good thing. So you start with occipital. It's on the back occipital part of your skull. Post-auricular is behind the ears. Pre-auricular is right in front of the ears. You always do bilaterally, of course, everything. Submandibular is under the jaw. Submental, come forward to the chin. And then you go down to the neck for the superior, anterior, cervical, superior, posterior, cervical. And then for deep, you just press harder and feel both of those. And then lastly is the supraclavicular. So you go to his clavicle right here, and it's right above the clavicle. And then once we're at the clavicle, we're going to do skin turner. So you pinch up on the skin and make sure when you let it go, it goes right back down. And then you always do 2 places on the body for that. So you do right here and then on the back of the hand. And he's very well hydrated. If he wasn't, his skin would stay tinted up. And then after that, this is where we also test the spinal accessory nerve for some reason. So, can you press up on me? Yep. We did that also in the other HEENT video. But after that, we are going down to his arms, and we are looking at the skin, always bilaterally, making sure it's smooth, that doesn't have any bruises, lumps, lesions, any sort of swelling. His hair is distributed nicely on his arms. There's no patching or balding. Just everything you're looking at. And then when you go down, you stop at the fingers and you do capillary refill, where you press down on his fingernail, watch it turn white, and then let go, and it should turn right back pink. If it doesn't, that means he has a poor circulation to his fingers. And so after that, can you squeeze my hands, please? And you always make sure you do bilaterally, both hands, and you test his grip strength. And you always rate it as what it is. If it's weak, can't squeeze at all. If it's strong, stuff like that. And then you go into the peripheral pulses. That's the radial on the thumb side, ulnar on the pinky side, and then brachial is on the inside of the arm. If you're doing blood pressures, you always put the stethoscope on the middle of the arm for the brachial, but for this to actually feel the pulse without a blood pressure cuff, you need to come over towards the side and you'll feel it. And then you always do bilaterally, so I'd check both of his radials at the same time, both of his ulnars at the same time, and both of his brachials at the same time. And since those are pulses, you always do rate, rhythm, and force, always bilaterally. And then after that, you go into the upper extremities range of motion, and I have a separate video for that one.